Okay. All right. So thank you for being here. Welcome, welcome, welcome. And so this is the first of my new series of webinars that I'm going to be conducting. And so we're going to be talking about a hot topic right now, which is beating COVID-19 and the next pandemic. So I'm your host, Ruben J. Guzman, and PH does not stand for the speed that I drive my car. All right, so it stands for Masters in Public Health, and I got that degree back at UCLA back in 1988, and I loved my program. I just loved it, and I had an important decision to make when I got done with my master's, because I had spent 3 years of training to become a physician at UC Davis School of Medicine. So I had the option to go back, and so I had to choose whether or not I was going to actually go back to medical school. At that point, I realized that I was passionate about preventing disease and promoting health as opposed to treating disease. So I made a bold decision to not go back to medical school, and I've never turned back. I chose to study lifestyle medicine on my own. I went into healthcare administration, did that for about a dozen years, and then I went into consulting. And I've always loved this whole notion of being able to empower people to change their lifestyle, to be able to make a difference in their health and the quality of their life. So in 2016, I went to the plant-based nutrition healthcare conference in Anaheim. And I discovered that there is now a new branch of the American Medical Association. It is the American College of Lifestyle Medicine. So lifestyle medicine is the newest branch of medicine, and it's based on being able to empower people to prevent, reverse, and treat chronic disease using an evidence-based approach, no weird stuff, evidence-based approach to change their lifestyle in the areas of nutrition, physical activity, emotional well-being, alcohol and tobacco reduction, healthy relationships, hydration, and sleep. And guess what? What we've been able to show is that we can actually do a better job of reversing and treating chronic disease than with medications. That's amazing. So I signed up for the next Lifestyle Medicine Conference in October 2017. They announced the opening of a board certification for physicians, for MDs and DOs, but also for professionals, for those who had PhDs and also a master's in a health-related field. That's me. I signed up, studied for a year. October 2018, went to my second Lifestyle Medicine Conference, took the exam, and I passed the exam. So I am a board certified lifestyle medicine professional, trained to empower you to prevent, reverse, and treat chronic disease. And I love this because I'm able to live into what Thomas Edison said well over 100 years ago, that the doctor of the future will give no medicine, but will instruct his patient in the care of the human frame, in diet, and in the cause and prevention of disease. A lot of wisdom that was said back then. So I get to do this every day. That's part of what I do. I wear two hats. One is a lifestyle medicine professional. The other is an executive and business performance coach. I put them together because it makes perfect sense to me that an unhealthy workforce is less than a fully productive workforce. So we might as well have a healthy workforce. So I put them together, and I do lots in that area. And I just want to let you know that those of you who have never been with me before, I have absolutely no conflicts of interest whatsoever. No gimmicks, no schemes, no products, no scams, none of that. I do this for free. I do these seminars for free because I'm passionate about eliminating chronic disease from the face of the planet, empowering every single person to live a thriving, healthy, and happy life. Why? Because I believe in the power of paying it forward. I really believe in that. And I think it's important for us as adults to leave a legacy for our future posterity. And I have 4 boys myself. So I want the world to be a better place for them and my future grandchildren and my great-grandchildren to come. So because I plan on being around for a long time. So the thing is, it's important for all of us to actually make a difference for our legacy to come. So it's important. So that's why I do this. That's why I do this. So you don't have to worry about any gimmicks or anything else like that. All right. So now, tell me if you, I hope you agree with me that Virgil was correct. He said this well over 2,000 years ago, that the greatest wealth is health. The greatest wealth is health. George, I don't know what you're doing with your, yeah, there you go. Just okay, very good. Thank you. All right, very, very good. So let me talk about what we're going to cover today, because we've got a lot to cover. I did this webinar back in the beginning of April, and a lot has changed and evolved since then. So I've got lots of updates for you. So first of all, we'll talk about a brief history of infectious disease. So you need to know the framework of how this whole pandemic has emerged. And then where are we now? This is really grim, and we've got some important statistics to look at. I want to share with you some of the data, important data sources. By the way, I'm going to send you not only an email with the recording of this webinar, but also I'm going to send you lots of resources. I will share with you all the websites of all the data sources that I have pulled from for this webinar. So you're going to get all of that as well. Then we're going to talk about who can get infected and how that process occurs. We'll talk about risk factors for complications that you need to be aware of. And then what can we do now? What can we do? What actions can we take? And then how can we prevent future pandemics? Because I got news for you, folks. This is not the last time we're going to have a pandemic. It's not the first, it's not the last, and we're going to have more in the future. So we need to be prepared. And then how can you be empowered to actually make successful lifestyle changes? So this is what I want to leave you with. And we want to have a strong, positive, uplifting message at the end. So stay to the end. You want to make sure you stay to the end. So we've got lots to cover. I'm going to ask you all to have an open mind and listen to the words of wisdom from one of my wonderful dear teachers who has some words of wisdom to impart to you. You must unlearn what you have learned. All right, so hopefully you'll pay attention to what Yoda has to say and really have an open mind. So I've got lots of information. I definitely want to be able to open it up for questions at the end. So we'll do this. I'll finish the PowerPoint and we'll just have lots of questions and answers. So we'll be able to do that. So hold on, we're going to go hard and fast for this time frame. Okay, now, in addition, I want to let you know, because I figure more of you are now on. So I contracted COVID-19 back in mid-February. So I went to Southern California with my eldest son, Aaron, and we went down to watch my youngest son, Joseph, swim at his collegiate conference championships at East Los Angeles College. So we stayed there in that area. And so we were, now how I believe I contracted the virus was that on the flight back from Los Angeles, Aaron and I were in a Southwest Airlines flight, and we were surrounded by about a little over 24 junior high school students from Rio Americano High School. They had spent the previous 8 days, I believe, visiting college campuses and Disneyland, which we later came to realize was a major epicenter of COVID-19 transmission. So here we are in this flight, closed container, closed quarters. These students were loud, obnoxious, vociferous, and lots of talking and coughing and whatever. All right, so, and Aaron, my eldest son, had the aisle seat. I sat at the window seat. Aaron came down with it the next day. I had it the day after that. Now, I did the smart thing. I stayed home. So did Aaron. We both stayed home and we recovered. Now, I had it pretty bad because I actually had, it's very interesting because I'm very healthy. I don't get sick. So for me to really get sick is really notable. And so what I ended up having was, yeah, I had the flu, the cold symptoms, then I had the flu symptoms. And with the flu, with the fever, I also had insomnia for 3 days in a row. 72 hours, I was miserable. I couldn't sleep, drove me nuts. All right. And then I ended up with the cough for about another 7, 8 days. So I ended up with the cough after that. Classic symptoms. No, there was no testing back then. We didn't have any of that available, but the symptoms were classic. So that's how I know I had it. And no, I did not pay to get my antibody testing because that was not available then either. All right. So the thing is, we know things in the medical community. You know things by classic symptoms. So that's what I had. All right. So now let's get started. A brief history of infectious disease. Consider this, my friends, that from a million years ago until about 10,000 years ago, there was absolutely no epidemics whatsoever of infectious disease. All right. So for thousands and thousands and thousands of years, we didn't have any problems, none whatsoever. So 10,000 years ago, what happened? What began this whole process of infectious disease? Well, a picture tells a story of 1,000 words. We started domesticating animals. Domesticating animals. So when we look at the history of how domestication occurred based on archaeology, what we see is that dogs were one of the first animals to become domesticated. Then it was sheep, and then goats and cows and pigs and cats and hump cows and llamas and horses and alpacas. And then let's see, we got other camels and chickens and more camels and then turkeys and eventually ducks. So the thing is, we have domesticated animals for such a long period of time. Now, in the study of infectious disease, what we recognize is this, and this comes from the London School of Hygiene and Tropical Medicine, so infectious disease. So one is that there can be an airborne transfer of viruses, okay? So the animals can actually carry these viruses, and it can be transferred. You know, if a horse sneezes in your face, you're gonna get a cold likely. All right. Then there's also vectors that transmit the infected agents from animals. So you get, like, for instance, mosquitoes can transfer from one animal to a human being. Then there's also close proximity to animals. Okay. So there's fecal oral transfer of animal body fluid and cuts and things like that. So people who work around the animals in farms, ranches. And then there's direct contact with animals, for instance, bites from an infected animal, or foodborne. For instance, if we consume infected meat or infected milk. So those are all these kinds of ways in which these viruses and zoonotic diseases can also be transmitted, including bacteria. So there's lots of different ways, and it happens with the animals. It happens with the animals. So we've seen that what we call, so since 10,000 years ago, what emerged were these infectious diseases of domestication. So what we show is that from cows, we have measles. From camels, smallpox. From pigs, whooping cough. From chicken, typhoid fever. From ducks, influenza. From water buffalo, leprosy. And from horses, the common cold. So lots of different diseases that have emerged that are very common. So a lot of people ask, where did we get these diseases? Well, now you know. Now, we've had that for a long period of time, but we didn't have serious problems too often, but every now and then we would, and then we'd have an epidemic. Now, what was interesting in the history of human beings is that around the 18th century, what we started to see were a different group of diseases. We call these the diseases of civilization. So what we started to see, because lifestyle started to change, and we started seeing people eating more meat, dairy, and eggs, and starting to have more fat in their diet and less exercise, and their lifestyle started to change. So we started to see increases in obesity, in diabetes, and heart disease, cancer, and strokes, and those lifestyle diseases is what we started to see. So that's very interesting. Now, something that is very interesting to actually look at. So infectious diseases were happening, that continued. And then 18th century, we're starting to see the diseases of civilization, but then there was a collision. All right, so we started to have a collision. So the first major collision that we see is that of the Spanish flu in the United States, 1918, 1919. Now, it was very interesting because the pandemic mostly killed young adults, which is different than what we're seeing with COVID-19. In 1918, 1919, 99% of the pandemic influenza deaths in the US occurred in people under the age of 65, which is completely different than what we're seeing in COVID-19. And nearly half of the deaths were in young adults, 20 to 40 years old. The number of deaths was estimated to be at least 50 million worldwide, and about, now here's the number you want to pay attention to, 675,000 occurring in the United States. Back then, we had a third of our current population, less than a third. We had about 103 million people. Now, what I want you to pay attention to in this graph is this, that when the Spanish flu hit, the first time it hit in the late spring, early summer. So June is when it hit. And so that was the first wave. And then it came down. But then the winter came, and the winter flu season came. So when the conditions for the transmission of influenza are also high, guess what? The conditions were also high for the transmission of the Spanish flu. So what we saw was that come around the end of September, early October, we started to see this huge spike in the deaths due to the Spanish flu. And this huge spike lasted all the way through until January, towards the middle of January. This spike accounted for the vast majority of all the deaths in the Spanish flu is in the winter of 1918, 1919. And then we saw another spike that's fairly large, larger than the first, and that happened in February, March, April. So that's what we started to see. So that's an interesting pattern. So we need to take this into account when we're dealing with the COVID-19, because we are now stepping into the flu season in the winter. So the winter is the most problematic time when it comes to any infectious disease. What's interesting to also note when we look at what happened back in 1918-19 is that there was a difference in Spanish influenza deaths in Europe. Thousands of people in Europe suffered the Spanish influenza, but one of the countries that was very interesting is the country of Denmark. And also a little bit, also very interesting was Finland. So what happened in Denmark is that in World War I, 3 million Danes adopted a vegetarian diet, a completely vegetarian diet, and they had less of an impact from the Spanish flu. Fascinating, fascinating. They also had less impact of heart disease, cancer, and strokes during that time frame as well. That was because of the North Sea blockade. And if you've been to some of my other seminars, you've heard me talk about it. Now, what's interesting to note is this, that in 1970, in the United States, the Centers for Disease Control and the leading doctors, the Surgeon General said, we have conquered infectious disease. We have won the battle on infectious disease. And what we saw was that, we were seeing infectious disease mortality going down. We had the Spanish flu, but then it started to go down and down and down. So by 1975, 1980, they said, we've won the battle. We've been victorious. And they were claiming that vaccines had done the job. But really, was that really the case? They didn't give credit to public health. I have a bone to pick with people. Public health actually had more to do with the decrease in death due to infectious diseases than vaccines did. Most people don't realize this. Public health made the biggest difference. Most of the vaccines got introduced after the decrease of the deaths due to infectious disease had already started occurring because of public health measures. So it's a misnomer to think that the vaccines are the savior of the population, because they didn't come into play until after there had been most of the progress had already been made due to public health measures. So this is what we want to keep in mind when we look historically. Okay, let's see. Yes, and a question from Tina, a great question. So will we have a repetitive process in terms of coming into the winter? Yes, absolutely. We're going to be repeating that. So be prepared. We're going to talk more about that. I'll get into the data in a little while. All right. So now here's what's interesting, going back to infectious disease. So we saw this decrease in infectious disease over these years, over these several decades. And then what we didn't pay attention to was what happened after 1970. We didn't pay attention to that. And here's what we saw. All right. So here's that first graph. We saw the decrease in infectious disease, but then come around 1980, what we started to see between 1980 and 1992, we saw the death rate from infectious disease increase by 58% just in those few years. All right, just in those few years, it was such an increase. And then what we've seen since then has been even more. And for instance, this is a graph of the spike in mortality, incidence of influenza in China. And we started to see this spike starting in around 2000, going up dramatically by 2018. So what we see now is a third group of diseases. What we're seeing is what we call diseases of intensification. Diseases of intensification. We are in a new era. We've had 30 new diseases since 1975, including AIDS, Lyme disease, Ebola, SARS, swine flu, MERS, COVID-19. SARS is believed to have originated with civets, Ebola and AIDS from primates. Almost all of these diseases originated with animals. Why? Because we as human beings, we are changing the way that animals live. As you can see in this picture, we are changing their way of life. This is not normal for a pig to live this way in their whole life inside a pen like this. That's normal. And it's because of our incessant demand for animal protein, which has risen so much in the last several decades. So we subject these animals to crowding and breeding. So we enslave them for their lifetime to be able to be in these situations. And we consider that okay. Well, that's going to come back to bite us. And that's what we're seeing, because all of these viruses, they start off as harmless. They really do. But we change the environment for these animals, and that's been leading to mutations of these viruses. And especially notable is the factory farms and the wet markets. They're really problematic because they are just absolute incubators for these viruses to mutate and emerge and then get transferred to us. I mean, this is a picture of a wet market in China, and this is how they sell their meat. It's out in the open like this. So nobody's wearing any protection. Nobody's even wearing gloves. I mean, they're just dealing with it with their skin. So this can evolve to make transmission occur from animal virus to the humans, and then eventually from human to human. The American Public Health Association, I'm also a member, has called for a moratorium on all factory farming, especially in the United States, but the World Health Organization has also concurred with this. We need to end factory farming. We need to end it. And this is what we're seeing. We're seeing this all the time, these wet markets. And by the way, we have these even in the United States. We do. We have them. We have them in New York. We have them in Los Angeles. We have them in San Francisco. We have them all over the country. They're all over the place. We have to keep in mind that how we treat animals affects us. For every action, there is an equal and opposite reaction. And so how we treat animals is absolutely affecting us. So now when we look at the extent of disease, what we define from a public health perspective is that an epidemic is usually temporary, it's short-lived, it's regional within a particular area, and a lot of people get affected. So that's what we define as an epidemic. It's in one particular area, but it's widespread in that area. But a pandemic is where we have a longer impact for a longer period of time. So it's not quite so temporary. So maybe a year or two. And it's a global spread all over the entire world, all over, widespread, wide reach. and it's universal. Everyone has the ability to be impacted. So that's one of the things that we see. So we are in the state of a pandemic. In fact, the map, this was April 2nd. By April 2nd, the countries and territories with confirmed cases of COVID had expanded to virtually the entire globe. And now what we're facing is this. We're facing headlines every single day. I mean, you can go onto YouTube and you can get, they have a particular sub-channel just on COVID-19 because there's news on it every single day. And so we're dealing with that. In fact, here's the latest statistics. So just want to bring you up to speed. Here's what's alarming. For me as now I was a hospital administrator. I've been a public health administrator as well. I was actually appointed by the Sacramento County Public Health Advisory Commission to serve the county of Sacramento. And this is alarming. This is alarming. All right, 68,516 hospitalizations in one, as of yesterday. This is yesterday. All right, that's alarming. That's a lot of people in the hospital due to COVID. In addition to that, we also, another record is we're averaging over 1,000. We're averaging 1,000 deaths every day this month in November. All right, so we're averaging that. That's a lot. And these are the states that have the highest concentration right now. You can see this is a large area of the United States that we're seeing being affected with this. So these are the most significantly affected states in the United States. In April, by April already, we had started to see COVID to rise up to over 1,000 deaths a day, and then became the third leading cause of death. It still is. It still is a leading, on a daily basis, it's the third leading cause of death. And when we look worldwide, we're not doing so well here in the United States. We're just not. And other countries are not doing well either, but we're doing the worst. We're absolutely doing the worst. So I'm going to send you all of this, by the way. And when we look at the graph of, this is the new deaths attributed to COVID in the United States, Italy, China, South Korea, Sweden, Australia, compared to all the other countries. But I wanted just to see this. This is the new deaths. This is the 7-day rolling average of new deaths by these countries. In the United States, you know, we got up to this peak close to 2,000 deaths per day. And then we've been hovering at about 1,000 deaths a day. That's where we're at. So it still is at that level. This is data as of yesterday as well. When we look at the total number of cases that we have, these are confirmed cases from Bloomberg. All right, so yesterday we had 190,000 cases confirmed in one day. Now, fortunately, we don't have as many deaths that are happening as well, but so we're seeing on the death side of things that the deaths are less, but there's a lag on deaths as well. So this is really concerning from a public health perspective. So this is where we're at. We've had a spike coming up. So as of yesterday, it was 2,238 deaths in one day. That's alarming because we haven't seen that for a while now. So it's climbing back up, and we're going into winter, my friends. So there is a likelihood that we may double this, according to the experts. We may double this. We may get to a point where we're having close to 4,000 deaths a day. So be prepared. Be prepared. That's what's happening. When we look at this, by the way, this is a great website. It's called the COVID Tracking Project. So what we see, this was as of November 13th, we saw 3 records: daily tests, daily cases, currently hospitalized, and daily deaths are rising. All right, so we're looking at all the data. By the way, here's what I tell people. In order to evaluate the data, you need to look at all the data. So I look at all of these dashboards every time I look at the COVID information. So I'm going to send you all these links so you can look at it the same way I do. All right, and then this is also, this is from Our World in Data. What we show is daily new confirmed deaths per million. So this is the number of deaths per million people population. And see, we had this spike back in April, but we've never gone all the way down. And we had the second wave back in August. And now here we are rising again. So it's happening again. We have to be very concerned about this. Regionally, what we're seeing right now, the area that was not hit before is now being hit, and that's the Midwest. So the Midwest is really being hit. Those were those states that I showed you in the red in the Midwest area. So we're seeing that. In addition, we have data that we're collecting on a regular basis. By the way, you can actually look at your state. So there's, I'm going to send you the links on this so you can look at it state by state, and you can see total number of cases, new cases today, change over the last 7 days, for instance. See, like today, this is as of yesterday. So a 10.1% increase in cases. All right, test increased 6.6%. So cases increased more. Hospitalizations. So we can see the number of hospitalized, those on ICU, those on ventilators, and then the outcomes. All right, so we're seeing all this data. So there is data available. You can see it for yourself as well. When we look at the state by state map, what's very alarming is this. So California and Texas have both exceeded 1 million cases for the first time now. So they're both in excess of 1 million cases. So it's alarming. Florida is getting close at 875,000, Illinois 563,000, New York at 551,000. So it's climbing. Deaths are also very high in those states. Proportionately, it's less in California, 18.2 thousand, 19.9 thousand in Texas, 11.1 thousand in Illinois, 34,000, still the highest is New York. 16.5 thousand in New Jersey, 17.5 thousand in Florida. So it's happening. Okay, so let's see. And then right now, the current risk. So what we're able to look at the data was that we're able to map out the risk level for COVID-19 based on daily cases that are happening right now. So this is calculated, and it's a very good map to look at. California did have a bit of red a while back, but now you can see in the map here that the Midwest is the area of greatest concern currently. This is the area that was not hit hard before, but now it's getting hit very, very hard. So this is the area of greatest risk. So we have the risk level. You can go on the website and you can see all the different counties, all the different states, and all the different amount of risk that they have for COVID. Now, I thought I'd share with you, because there's varying amounts of statistics. When you look at the pattern of COVID, what we're seeing is this, and this is pretty typical. Now, I pulled it from just Sacramento County. I can't go into all of it. All right, but in Sacramento County, here's what we see. In terms of the infection, so the cases, all right, people infected with the virus, the biggest age group for infection is 20 to 29. So our young people, 20 to 29, that is the largest amount of infections. It goes down from there. And then what we see, the least amount is the 80-year-olds and the 0 to 9-year-olds. All right, so that's where we have the greatest influx of cases, is 20 to 29-year-olds. So this is in Sacramento County. However, now look at the pattern of this graph. When it comes to the deaths by the same age group breakdown, what we see is this. So this is what we see. So 80 and above, it's 245 for the same group of 1,279. So that works out to about 19% of that population is dying from COVID, and it goes down from there. When we look at the data for the 65 and older, what we see, that's the vast majority in Sacramento County. Over 75% of the deaths are in the age group 65 and older. So if you're over the age of 65, I just made you feel a lot more uncomfortable right now. It's absolutely the case that we have right now. And then 50 to 64 is another almost 20%. So the younger we are, we see less complications and less mortality, but it doesn't mean it doesn't happen. It still does happen. There's a wide range of this. So that's what we're seeing. Now, by sex, it's very interesting as well. What we see in Sacramento County, and this is fairly typical that we see in the national and international data, is that more females get the virus, just slightly more. It's about 4% more. But in terms of the death rate, more males die from COVID than the females. And it's almost a 10%. It's about a 9% difference in terms of deaths. So that's a bigger difference than that. Initially in China, we saw the same thing. So what we saw was that there was a much higher death rate with confirmed cases in males than versus females. And one of the things that was looked at was that males smoke more in China than females do. So we see that those are all part of the factors. So we see risk factors due to comorbidities and lifestyle. And when we looked at the initial data from China, what we saw as far as the fatality rate by comorbidity, we can see here that cardiovascular disease, 13.2% death rate for those with confirmed cases of COVID versus the no pre-existing conditions, a little less than 1%. So when we have comorbidities, what we're starting to see now is that most of these comorbidities also come with extra body fat and higher obesity levels. And we're seeing that this virus actually infiltrates the fat tissue in particular. And it's one of the areas that it allows it to replicate the virus and to perpetuate. And what we see in the United States, it's even more dramatic. We see that COVID deaths and comorbidity in the United States, only 6% of the deaths in the United States listed COVID as the only source of their death. 94% of the COVID deaths were with people with comorbidities. All right, so that's because the virus actually works more effectively when there's more fat and less poor immune system, more inflammation. It's going to be a foothold for the viruses. So when you do the math, that means that's a 15-fold increased risk of dying from COVID if you have an underlying condition. And we've seen this in many other things. So close to 15 times. The CDC actually said 12 times. So hospitalizations were 6 times higher and deaths 12 times higher for COVID-19 patients with reported underlying conditions. All right, compared to those with no reported underlying conditions, especially cardiovascular disease, diabetes, and chronic lung disease. So that's what we're seeing in the data. So it's fairly consistent. So why is that? Well, let's look. In the United States, heart disease, cancer, and stroke account for more than half of all the deaths every single year. 86% of our nation's healthcare costs are spent treating people with chronic disease. 70 million Americans right now have hypertension with elevated risk for stroke and heart attack. That's heart disease, folks. All right, 100 million are projected to be diabetic by 2050. All right, 130 million are affected by chronic disease. That's 40% of the population right now. And 70% of all Americans are overweight or obese. If we look, the risk of complications from COVID are related to, so Maureen, if you could delete all your little marks there. Okay, all right, very good. So the complications include hospitalization, ventilators, and dying. Comorbidities include obesity, chronic disease, immune diseases, and smoking. All right, one comorbidity, what we've seen in the data is that there's a 79% increase risk of complications. But with 2 or more comorbidities, this is where it gets alarming. There is a 250% increase risk of complication. Now, the United States population with 2 or more comorbidities right now is approximately 133 million. That's 40% of our population. Let's see, Maureen, you put on these little marks on my slide. You can probably see about taking those off. Okay, all right, very good. Okay, so here's what we need to look at, the map of all of these chronic diseases. So here's the map. This is my research. Some of you have seen this before. So this is the map of all the counties in the United States where there's been mortality due to heart disease. So the pattern of death due to more heart disease, the southeast portion of the United States in particular, and all through the Midwest. All right, so if we look, this is cancer. This is the pattern for cancer. Big marks in this area. All right, if we look at, this is lung disease. All right, COPD, really a problem when it comes to COVID-19 right now. All right, let's look at strokes. So strokes. So Maureen, I think you put on these red marks. It said your name when you were doing that. So if you could please delete them, that would be great. Okay, so this is This is for strokes. This is alarming. And this is the pattern that we're seeing with COVID as well. And then if we look at Alzheimer's, that's a chronic disease. We're seeing this, especially in the long-term care homes, especially. Diabetes is another risk factor that we've identified for COVID. Definitely the case, the southeast portion of the United States. The states with the lowest life expectancy in the United States are these 10 states in geographic proximity to each other: Oklahoma, Arkansas, Louisiana, Mississippi, Alabama, Georgia, South Carolina, Tennessee, Kentucky, and West Virginia. All right, so those are the states that we see the highest rates of chronic disease and the lowest life expectancy. They've done this map. They've actually projected where people are more at risk for severe COVID-19 illness. Guess what? It matches up, doesn't it? So this is what we're seeing, and we're seeing that it's being played out. We're seeing that right now playing out in this risk level map that I showed you just a little while before. Now, as a public health professional, we're looking at the projections based on how fast this virus can actually transmit. All right, and so we want to be able to understand some projections and what we can actually look forward to. And this is kind of scary for us, folks. All right, so what we see is this. There's about 331 million people here in the United States. Now, the Centers for Disease Control, based on the World Health Organization data and many other data, we estimate that when this is all said and done, we'll probably be in a neighborhood of between 40 to 70% of the American population getting infected with COVID-19. That's a lot. So if we go conservative, let's go really conservative. Let's say it's closer to 40%. So let's just say 150 million people. 45, it's a little under 50%. So I'll just say there, 150 million people infected. That's a conservative estimate. Now, here's what we notice. There are some people that have absolutely no symptoms. It's projected about 30% of the population that get COVID-19 are asymptomatic. That means they have no symptoms whatsoever. We've never seen a virus like this before. This is absolutely the most interesting, and it's pretty wild. So what we see is that there's about 30% that are asymptomatic, no symptoms whatsoever. People don't even know that they have it, but they can still transmit it. That's the concern. Now, there's another 30% or so that will contract it and be mild. All right, so they'll have mild symptoms. It won't be very bad. It'll be minor. It is like no big deal. Okay, so people will say that, and they'll say no big deal. Okay, fine. Then there's another 20% or so. They're going to have a fairly significant, like I did. It affected me. I had insomnia for 3 days. I felt sick. I stayed home. Couldn't do much. All right, so there's that 20%. So that gets us to about 80%. Now, there's the next 20%. The last 20%, those are the ones that are going to get really sick. They're going to need hospitalization because they'll get short of breath. All right, so they're going to need hospitalization. And of those, there's about 5 to 10% of them that are going to need to be on ventilators or more aggressive treatment. Now, the treatment protocols have actually improved. I'm not going to talk about the treatment protocol today, but the thing is, it has gotten better. But if we did the math based on the 331 million and the number of people that get infected, and number of people that need ventilators, that would work out to be about 7.5 million ventilators. Folks, we don't have anywhere close to that. We don't have close to that. And we don't even have close to that number of hospital beds to take care of people. That's really the problem. So hospital administrators like me, like I was, all right, are looking at, this is a nightmare because we're going to run out of beds. We're going to run out of equipment. We're going to not have enough staff. I mean, if we go bonkers on this, it could be a real serious problem. And remember that second spike in the Spanish flu pandemic? That's what we're concerned about right now. The first wave was nothing, my friends. This, what we're coming into right now, is the most alarming period. This is where it could be 5 times more than what we experienced back in April, May, and June. So this is what we have to be really concerned about, and it's really concerning. So we're alarmed. From public health perspective, we are definitely alarmed. Maureen, I think you still have these marks up here. You could somehow take care of those. That'd be great. All right, now, who can get infected? I put this picture up for a reason, because guess what? It's everyone. It's everyone. Everyone can get infected. All right. No one, and we do not have established immunity on this. We don't have any evidence that immunity really lasts for any significant period of time. So we don't have enough research on this, but anyone can get infected if they haven't been infected. So how infection occurs, we have to be mindful of this. Generally speaking, this virus is going to be transmitted with sustained close physical contact, usually about 15 to 30 minutes. Could be shorter. Hand-to-face contact is usually one of the best, most easy ways for the virus to be transmitted, but coughing, sneezing, and talking in close proximity also matter. Okay, now these pictures are intentional because we know what happened in the White House. Yeah, we do, don't we? We know. Yeah, here's the timeline of exactly what happened in the White House. And, dear Mr. President Trump actually contracted the coronavirus and a whole bunch of other people. All right, because yes, this was a super spreader event because they were not paying attention to what the public health professionals have been saying all along, that we need to have social distance. So what happened? Oh, in this event alone, all these people ended up contracting the virus. Yeah, no kidding. No kidding. All right. So look, my friends, as a public health professional, I need to warn you. All right. I need to share this with you. Skipping large family gatherings as we go into the winter and the holiday season is the most important thing right now. Okay. It might just ensure that you get to see those family members in 2021. So really keep it small, keep it personal, and stay safe. Really practice this, okay? Really, the government does not have a national plan for this. All right, the governors don't have anything saying about the family gatherings. All right, but we need to be aware of this. So you've been informed. This is from one of my friends who's a physician who is on the front lines fighting COVID-19. She's a cardiologist. All right, so she's very, very clear that we need to be able to eliminate the large family gatherings for 2020, just this year. I know it's hard. I know we all want our social gatherings, but we got to do it. Here's some rules to pay attention to. Number one, keep your hands clean, really important, because that's how we touch our face more than we realize. I mean, I forget the date on this, but we tend to, as human beings, we tend to touch our face hundreds of times a day. So keep your hands clean. And then avoid touching your face, but wear a cloth mask, especially in public, okay? So in public, you've got to wear a mask. That's really important. Trader Joe's is one of the best places because they were on top of this right off the bat. So really be on top of that. Wear the mask. You can't go into the stores without a mask these days, many of the stores. Adhere to that. It really makes sense because we've got the research showing that it absolutely limits the spread of the virus. It really reduces it significantly. Now, you want to distance yourself, all right? The 6 feet, absolutely a good idea. And again, avoid the gatherings, okay? Really avoid the gatherings. Now, the 3 typical stages that occur when we are in this virus, okay? If you get infected, it's going to be like this. First are usually the cold symptoms. You get the scratchy throat and the runny nose, okay? And you get better, usually. All right, and then you get the flu symptoms, and you get the fever and the body aches, the headache and the weakness. All right, in my case, I got insomnia on top of that. All right, so you feel pretty bad, pretty crummy. All right, and then you get a little better. And then the respiratory part comes in. You get the coughing, which, if it's unchecked, could lead to pneumonia and shortness of breath. The shortness of breath is of concern. That's what we're worried about. So if you get this virus, all right, do not panic. Do not panic. What you got to do is isolate yourself, all right, for 7 to 14 days, depending on you. Everybody's a little different. Everybody's a little different. Pay attention to how you feel. So eliminate sustained contact with anyone, all right, with anyone. Wash your hands frequently. If you can have a separate room and bath, that is desirable. You want to be able to do that. If you have a shared bathroom or a shared room, makes it much more difficult, but you want to isolate as much as you can. If you're around other people in your family and your household, wear a mask when you're around them. Okay, and they should wear a mask around you as well. Now, when do you go to the hospital? I've had this happen a couple of times with several people. Okay, so when do you go to the hospital? All right, it's not for a runny nose. All right, please don't do that. Okay, don't. I have friends that are emergency room doctors. They go, come on now. All right, not for a runny nose, not for just fever or achiness. Okay, that's not the time. All right, you can stay home, rest, take care of your fever, drink plenty of water, do the things that you need to. That's great. That's what you want to do. And not for just a cough. If you just have a cough, that's fine. That's to be expected with this virus. Don't go to the hospital for that. You go to the hospital when you have shortness of breath. All right, when you absolutely have shortness of breath, you cannot breathe. Coughing is fine, but the shortness of breath, like you have a shortness of breath walking to the bathroom or when you just even sit down, that's the time to call your doctor and let him know, let him or her know that you've got shortness of breath. And this happened, it was my younger son's mother, and she was infected. And then I did the screening and I said, okay, does she have shortness of breath going walking to the bathroom? And the answer was yes. Does she have shortness of breath when she sits down? Yes. I said, okay, Joseph, it's time to take your mother to the hospital. So they took her to the hospital, checked her out. Turned out that she was fine. All her indicators were fine. So he said, it looks like you're getting better. So she went home and recovered and she was fine. She recovered just well. So, but that's the time you want to get checked. All right. So you do want to do that. Now, as far as treatment options, no hydroxychloroquine, no bleach. Okay. None of that stuff. Okay. By the way, we've had more misinformation from dear Donald Trump than anyone else on the face of the planet, according to the New England Journal of Medicine. All right. So now don't pay attention to what anything he has ever said. All right, there is no vaccine available yet. They're working on it. It's going to get released. Who knows? But the thing is, it's not a treatment. A vaccine is never a treatment. It's a prevention, hopefully, and it's not 100% foolproof either. So the thing is, you can't count on a vaccine. All right, and this is still a new virus. So herd immunity is not an option right now. It's not getting there. We have not reached 75% of the population with this virus. It hasn't happened yet. We got a long ways to go before we get there. So we're not developing herd immunity anytime soon. Remember that the mortality of this is about 10 times more than regular influenza. So what we've got to do right now is limit the spread more than anything else. So that's what we've got to be able to do. So here is a graphic to really help understand how this all works. So in terms of being able to prevent the spread of the virus, we need to utilize every modality possible. None of them are 100%. They've all got holes in them, all right? So you think of the Swiss cheese model here, all right? So physical distance, stay at home if you're sick, all right? So that's the first level. Second, wear a mask when you're in public and interacting with other people. Hand hygiene and cough etiquette, absolutely do that. Practice that frequently. Avoid touching your face, all right? Very important. And then if it's crowded, limit your time. So those are the things that you can do personally. So those are your personal responsibilities. As public health professionals and clinicians, what we're asking everybody to do is practice these things, please. Because it's making a difference at the tail end in the hospital. We need to be able to practice this. Now, shared responsibility. Okay, fast and sensitive testing and tracing. Well, our government's not doing that yet. All right, we're getting there, but we've got a long ways to go. Ventilation, outdoors, air filtration, that can help. Government messaging and financial support, well, they are behind the times as far as that's concerned. Quarantining and isolation, we do some of that in some places, but it's spotty. Vaccines is the last resort part of this process, okay? The last piece of this. So we need to be paying attention. This is like a Swiss cheese model. and all these different slices of Swiss cheese. And what we're trying to do is minimize the risk and minimize the spread. So that's what we're out to do. So what can you and I do? What can we do? All right, follow the 5 rules that I mapped out. Get tested if available. If you feel like you need to get tested, then go ahead and get tested. That's really a good thing to do. If you're interacting with people, if you're an essential worker, you're interacting, then it's a good thing to get tested from time to time. Stay home as much as you can. That's the safest place to be. It really is. Try to limit how much you go out and interact with other human beings. All right. I know it's hard. I know there's a lot of different effects of this. Really, we do. We understand this in medicine. We do. Improve your lifestyle. So focus on the positives. How can you improve your lifestyle? We're going to talk about this and how to strengthen your immune system. So that's the positive side of all of this, is that you're going to have an opportunity here to be able to actually improve your lifestyle. What we need to be able to do is, if we do this, we can then we can build resilience. We can build resilience. All right. So this is my friend Nimai Delgado. All right. So resilience is defined in psychology as the capacity to prepare for disruptions, recover from shocks and stresses, and adapt and grow from a disruptive experience. So consider, my friends, that we have an incredible opportunity right now. Every adversity presents a danger, but it also presents an opportunity. So we have an opportunity to build resilience. And that's what I'm hoping that's the intention of this webinar, is to provide you with information that can empower you to build resilience and to be able to be really stronger as a result. To do this, we have to understand the context for how we can actually build resilience. And it begins by understanding this concept, this fundamental concept, that all of life is in one of 2 states at any given moment. Either it is surviving or it is thriving. And that's all there is. That's all there is. Now, when Dr. Kalitsky said this, I didn't understand this, and I didn't get it until 3 years later. And I was in medical school, in my first year of medical school, in a class called embryology. And what I discovered is that the first organ system of the body to become distinguishable and operational arises from the neural tube. The neural tube gives rise to what we call the limbic brain, which is the core of the brain. That's your hippocampus, your amygdala, your pituitary, your hypothalamus, and then the entire spinal cord. This is the central nervous system of the body. It runs the show of our body. It runs everything. So what we have to be able to do is understand that at a neurological level, the central nervous system is running our body. Everything in our body is affected by the central nervous system. And it's the electrical system of the body. And just like any basic electrical system, it's got 2 currents. It's got a positive current, which is what we refer to as the parasympathetic branch. And it's got a sympathetic current, a negative current, which is what we call the sympathetic branch. So these 2 currents. Now, here's how the body works, and what the professor said, that if the parasympathetic state is on, it is on for all the organ systems in the body. Every cell in the body is operating in the parasympathetic state. So it's a current that affects every part of our body. Conversely, when the sympathetic state is on, it's affecting every organ system in the body, every cell in the body, in the opposite way. So these 2 currents are polar opposite of each other. You got a positive and a negative. So when we're in the sympathetic state, we are reacting to stress. Our body is triggered to be able to survive. We may recognize fight, flight, freeze, or fold as some of the outward expressions of being in the state, but even as subtle as a perceived threat is enough to trigger us being in the sympathetic state. So our mind is powerful. And what we show in the literature is clear, that the common thread of all chronic disease is being in the state of dis-ease far too much. And that's why lifestyle medicine is fundamentally all about being able to empower you with the lifestyle habits that fundamentally shift you from being in the sympathetic state far too much to being in the parasympathetic state more of the time. And when we're in the parasympathetic state, we experience peace and pleasure and rest, digestion, fun, play, and ease. But that's where our body's thriving. That's where our body is healing, and we're doing really well. So this is what we want to be able to do. Now, next week, I'm going to do a webinar on the 5 secrets to living a thriving, healthy, happy life, which is fundamentally how do we shift from being in the sympathetic state too much of the time to being in the parasympathetic state more of the time. So in a quick summary, here's how we do it. Here's how we do it. First of all, it begins inside. We must begin from within. So the first element and we have control over all 5 of these. So it begins with our thoughts, the thoughts that we think, because if we have stinking thinking thoughts, if we're worried, we're complaining in our heads, we're being anxious, we're being depressed, any of those thoughts in our head, then that's going to put us in the sympathetic state. And so what we have to learn to do is manage our thoughts to put us in the parasympathetic state with the power of positive thinking. Very important. Second are the words that we speak, because guess what? If we're complaining, if we're gossiping, if we're being critical, cynical, skeptical, guess what? That puts us in the sympathetic state. So what we need to be able to do is use the power of positive words that actually lift us up, that are encouraging, supporting, uplifting, motivating. That's how we stay in the parasympathetic. Third is the actions that we take. Because if we say we're going to do something and we don't do it, the moment we do that, the moment we break a promise to ourselves, we are now in the sympathetic state. So we have to learn the magic and the power of integrity, that we make promises not only to other people, but to ourselves and keep them. That's integrity. The fourth is the company we keep. We know from the research now, there's dramatic research showing that we are definitely impacted not only by our friends, but also our family members, but their friends and their family members. It's amazing. People we've never even met, but yet we're affected and impacted by them. So it's really important that we monitor that and manage that. We know that we're the average of the 5 people we most associate with, and then some. So we need to be able to have an inner circle that is positive, and is that we manage the people that have stinking thinking, and we love them from further afar. It doesn't mean we stop loving them, we just manage them. And then fifth is the food that we eat, because guess what? Food affects us neurologically. Most people never think of it that way. But food can either trigger the sympathetic response in our body or a parasympathetic response in our body. And this is really important and fundamental to us being healthy and being able to build resilience. So that's what we need to be able to do. Lifestyle medicine is onto this. This is the foundation of lifestyle medicine. We recognize in lifestyle medicine that it's a foundation of healthcare today, because 80% of healthcare is chronic disease. And 80% of chronic disease, at least, is caused by lifestyle habits. So if the disease is caused by lifestyle, the foundation ought to be a lifestyle treatment. And this is true for all the people with comorbidities that are at risk for complications from COVID-19. So what I want to share with you now is what we can do to make a profound difference. Is we can practice improving our lifestyle in all these areas: hydration, nutrition, physical activity, harmful substance reduction, sleep, emotional well-being and stress management, and healthy relationships. So I have seminars on each one of these topics extensively. I just want to give a quick brush through on this to get you some tips to get started, especially those who have never been with me before, so you can get started to really help you. And I have some additional tips specifically related to COVID as well. So let's go into this. So first of all, I'm going to deal with is hydration. That's number one. In my book, it's absolutely number one. I start with every single one of my clients with hydration. Why? We know in the research is this: if we're in the sympathetic state, it's no different than being stranded out in the middle of the desert. And if you were stranded out there, the first thing you'd be looking for is water. Yeah. And what we show in the research is that 5 glasses of water a day decrease the risk of stroke and heart attack by 50%. Are you kidding me? This should be on CNN every night. It's not. So we need to drink our water. And this is really important. If you want to be able to resist the COVID infection, we need to have our body be in the parasympathetic as much as possible to strengthen the immune system. Everything has to work. So we need to drink our water. Most people do not drink enough water. They just don't. They're drinking sodas, they're drinking sugary beverages, they're drinking all kinds of other things. They're not drinking enough water. So it's really important. So my tips for you is to drink 2 full 8-ounce glasses of water first thing in the morning. You get up, drink those 2 glasses. Hydrates your brain. Your brain does not need the caffeine. It needs the water. Your brain is 80% water. So drink a glass of water before and after each meal. If you want to lose maximal weight, we have research showing 44% greater weight loss by drinking 2 glasses of water before each meal. All right, so drink your water and drink a glass before your workout and drink 2 glasses after your workout. So drink your water, water. Now, I give you permission here and now to check your pee. Make sure that it's pale yellow to clear. So you want to take a look. Yes. If it's dark yellow to amber, you're in trouble. You're dehydrated. All right, so that's hydration. Next one is going to be nutrition. So here's what we show. There is only one dietary approach. This is from the American College of Lifestyle Medicine, the American College of Cardiology, and the American Medical Association all agree there's only one dietary approach that reverses atherosclerosis and heart disease, causes positive genetic expression, increases our telomere length, and demonstrates the best long-term, not short-term, long-term weight loss. Huh, only one. Well, I wonder what that is. Well, the American College of Lifestyle Medicine, the American College of Cardiology, and the American Medical Association all agree that a whole food, plant-based dietary approach is optimal for health. They all agree. Okay, so now let's talk about this clinically, just clinically. Let's talk about the #1 cause of death is heart disease. Dr. Caldwell Esselstyn wrote this book, Prevent and Reverse Heart Disease. And what happened was that he saw this research from years ago that in Norway in World War II, before World War II, heart disease mortality was climbing up. And then in 1939, what happened? It started to decline precipitously. So what happened in 1939? Nazi Germany invaded Norway and confiscated all the animals. So the Norwegians were left with potatoes and vegetables. That's all they had to eat. So they had potatoes and vegetables, heart disease mortality plummeted. Amazing. So then Dr. Esselstyn said, okay, let's do this. I'm going to take the sickest people we've got over here at the Cleveland Clinic. And he took 24 people who had already been told to prepare for death, get your affairs in order. All right, he took those people and he said, all right, I'm going to put you on this Norwegian diet, a whole food plant-based diet. It's a Norwegian diet, just like Norway. All right, we're going to put you on this diet. Now, the 6 who refused to follow, they did not follow, they all died in a much shorter period of time. But the 18 who did follow, they lived free of heart disease for at least 20 years or more. Amazing. That led to him writing his book and extending a warranty period of 25 years or 25,000 miles, whichever comes first. So now, people criticized this study because they said it was too small. It was only 24 people and it wasn't followed systematically. So Dr. Esselstyn said, fine, I'll do another study. So Dr. Esselstyn did his second study starting in 2010. He took 198 patients, so 8 times as many people. 21 did not follow the plan, so 11%. 177 did follow the plan, 89%. He then published the results in the Journal of Family Practice. I'm going to send this to you in 2014 after a 4-year follow-up. So I graphed out the results. So the people who did not follow the plan, all right, so red is bad, blue is good. All right, so now here's what we see. So the people who did not follow the plan, 62% had a follow-up cardiovascular disease event within the 4 years, which is what we would expect. They already had established heart disease. We would expect that they would have a repeat event, 2 out of 3 likelihood that they would have a repeat event within 4 years. We have other research studies that backs it up. Okay, 38% did not. They remained free. Now, the people who did follow the plan, here are the results. All right, one person went on a business trip, had a greasy cheeseburger, 99.4% free of cardiovascular disease for 4 years. Huh. We have never seen any statin drug, any other medication come close. This is remarkable, remarkable, just by changing the diet. Now, in addition, we also showed in the research at the genetic level, Dr. Elizabeth Blackburn over at the University of San Francisco, she showed at the genetic level that putting people on a plant-based diet, there are 500 genes that got changed in just 3 months period of time that prevent disease or turn off the genes that actually cause cancer, heart disease, and other illnesses. Amazing, amazing at the genetic level. In addition, she also showed that being on a plant-based diet increased the length of the caps of our chromosomes. This is a chromosome, all right, so a human chromosome. So this green portion here is the cap of the chromosome. The longer the caps, the longer we live. And so what she showed is that a plant-based diet increases our longevity. In addition, we had research published last year in April 2019 in the International Journal of Disease Reversal and Prevention showing that the plant-based diet, when going head to head with all the others, the paleo, keto, and all the other diets, that a plant-based diet scored best in long-term sustainable weight loss. I'm living proof. 25 years, lost the 55 pounds and kept it off. All right. Now, when we look at how Americans eat, no wonder we have problems and we're at risk for high mortality due to COVID, because here's how we eat. All right, this is straight from the USDA. Only 12% of the American diet is made up of plants. 12%. 25% is made up of animal food, meat, dairy, eggs, fish, and seafood, high in cholesterol. And 63% of our diet is made up of added fats, oils, sugars, and refined grains, processed food. That's a problem. When we do the research on the people who have the longest and healthiest lives on the face of the planet, that's called the blue zones. So these are the areas where we have the highest number of centenarians, and they are just really, really healthy. So Loma Linda, California, with the Seventh-day Adventists that live there, the Nicoya Peninsula in Costa Rica, Sardinia in Italy, Icaria, Greece is an island, and Okinawa, Japan. So this is what we show in the research. And we've done the analysis on their diet. So here's what we show in the Nicoya Peninsula. They have a minimum of 58% plants. That's about more than 4 times of what we have in the United States. All right, so that's the Nicoya Peninsula. If we look at Sardinia, what we see is 63% plants, even more. All right, if we look at Icaria, Greece, we see 78% plants, even more. And then if we look at Loma Linda, California, we see 81% plants. Fabulous, really looking great. And then the healthiest outcomes are the centenarians in Okinawa, Japan, and they have a whopping 97% plants. Yes. Wow. Now, the country of Canada, our neighbors to the north, decided to look at all this research, throw out all the private interest groups, and they did an analysis in order to develop their food guide. Their food guide for the country of Canada. They did this last year. And based on the research, they showed a food plate with a minimum of 88% plants. 88% plants. The United States, 12% plants. We're not even close. We're not even close. So the reason this all works, why this nutritional approach works, is because at the cellular level, which is the fundamental unit of the body, we need 2 important fuels. Number one, we need glycogen. I'm going to talk about this in a second. And then we need some triglyceride. Those are the two fuels to run our engine, which are the organelles in the cell called the mitochondria. Protein, my friends, is not for fuel. Protein is for parts. Everybody has been brainwashed in America thinking that they need more protein, and it sells like crazy. No, protein is for parts. Attend my webinar on the truth about protein. Check it out. All right, so we need fuel being glycogen and triglyceride, mostly glycogen. So if we do that, if we look inside the cell, we can see why. It's very, very clear. In order to produce this molecule here, adenosine triphosphate, this is the energy molecule of the human body. It is maximally produced inside the mitochondria, little organelles inside the cell. They're like pistons in an engine. We need a little bit of fat to come in to help grease the engine, to work it, to oil it. All right. And then we break down this substrate molecule called pyruvate, which is half of a glucose molecule. And the pyruvate has to be broken down from over here, glycogen. Glycogen is the internal gasoline station in the human cell. So this is our gas station, glycogen. So this is a human complex carbohydrate. It is a human complex carbohydrate. There are many different kinds of carbohydrates. And everybody thinks, oh, carbs are bad. No, that nothing could be further from the truth. We need the right kinds of carbohydrates. So in order to formulate glycogen, which is the human carbohydrate that we need for fuel to break down into pyruvate to become energy, we need two specific carbohydrates. Only two. There are only two. There are hundreds, there are dozens of carbohydrates, really, more than that. So amylose and amylopectin are the two specific carbohydrates that we must have in our diet in order to provide us with the energy. So amylose and amylopectin, all right, here they are. One's a spiral molecule, the other one looks like a tree, but then they get broken down. There's an enzyme in our saliva called amylase that helps to break them down so that we can formulate glycogen. All right, this is what we formulate inside the cell. Glycogen, amylose and amylopectin, you probably have never seen them on a food label. No, you don't go to the store and see the marketing says high in amylose and amylopectin. I've never seen that. All right, but amylose and amylopectin are what we need, otherwise known as starch. Yes, this is the cover of the scientific journal, Starch. Starch, amylose and amylopectin. There are scientists who study how to utilize this for our body. And this is what we need. So starch for you and me looks like this: legumes, beans, peas, lentils. Got over 2,000 varieties. You'll never get bored. All right. It looks like whole grains, whole steel cut oats, brown rice, quinoa, amaranth, spelt, barley, farro. So many. There's so many wonderful grains. Amazing, amazing. All right. Then starchy vegetables. Starchy vegetables are a fantastic thing for starch. Potatoes. By the way, the Incas developed potatoes. They did over 4,000 varieties. You will never get bored. All right, then sweet potatoes, squashes, there's tons to choose from. Lots and lots. Seasoning is the secret. And then all plant material produces starch, including all vegetables. So all vegetables produce starch. And in case you forgot what vegetables look like, I thought I'd show you a picture. All right, so then fresh fruit are fantastic. They're fantastic for us to have. Fresh fruit, not processed fruit, but fresh fruit. That's what we want. So naturally high in fructose and all the phytonutrients and fiber is fantastic. So what we also show in the research is this, and I want to share this with you. And this is why it's important in relation to COVID. What we show in a clinical trial in terms of being able to decrease inflammation, that a vegan diet resulted in a 32% lower high sensitivity C-reactive protein when compared with the American Heart Association diet. All right, so we see dramatic decrease in inflammation right now. Right now, this is critical. You want to be able to be ahead of the game in terms of having lower levels of inflammation. If you've got a chronic condition, you want to absolutely reduce your inflammation right now. It's really important. And you want to be able to reduce the formation of trimethylamine oxide, which comes from eating meat, dairy, and eggs. All right, so when you eat meat, dairy, and eggs, you're going to form more of this compound called trimethylamine that gets to the liver and gets oxidized, and it forms an inflammatory response inside our blood vessels, leading to the scarring and the plaques and everything else. So we want to stay away from trimethylamine, especially now. Especially now. So what we show is this, that the more phytonutrients you consume, period, the faster your body can recover from exercise-induced inflammation, from any inflammation and oxidative stress. And right now, people have a lot of stress. So we need to be able to have as much of the phytonutrients as we possibly can. The benefits of this plant-based approach, amazing. Amazing. I mean, I'm not going to even read all of them. I mean, there's so many. I've got 2 full pages of this. I mean, there's so many benefits from being on this. And there's research on every single one of these. Every single one of these. All right. So none of this is weird stuff. It's not airy-fairy stuff. There is research on every single one of these points. So consider this, my friends, that the food that you eat can either be the safest and most powerful form of medicine, or it's the slowest form of poison. And you get to choose. Now, with COVID-19, here's the thing. If you choose the foods of poison, you're going to put yourself at much higher risk of complications. So you really have to think every time you eat or drink, you're either feeding disease and putting yourself at risk, or you're fighting it and preventing the risk and lowering your risk significantly. So this is my food pyramid. So I'm going to send this to you so you can check it out. So food neurologically breaks down like this: meat, dairy, oils, and processed foods, sugar, deep fried sodas. Legal drugs include caffeine, nicotine, and alcohol. And then excitotoxins include things like MSG and aspartame. All right, those are all toxic and cause inflammation and are life depleting. So you want to stay up here with what we talked about: starchy veggies, whole grains, legumes, greens, colorful veggies, and fruit. In particular, right now, the most important thing that you can do to strengthen your immune system is not take supplements, folks. It's not. All right, you need to get high nutrient dense food into your body. So I'm going to refer you to this wonderful, wonderful colleague of mine, Dr. Brooke Goldner. She's amazing. She cured herself from lupus, which is not an easy thing to do. It's incredible. Now, I want you all to get this book on the right: Green Smoothie Recipes to Kickstart Your Health and Healing. Get that book. It's got a wonderful set of recipes of smoothies that you can create and start chugging these things down at least one a day. That's my recommendation. That's my recommendation right now. One a day. Just have those. Really make those. So you want to do that. That's the best thing you can do to strengthen your immune system. Don't go buy all of these different kinds of supplements. Forget all that. All right. Go with whole foods right from your supermarket. You can do this. So she is fabulous. She's got great information, great website, lots of fabulous videos. You can learn lots from her. All right, so that's nutrition. Let's move on. Next area, physical activity, critically important. Critically important. So we need to be active. It's very important for our health. Exercise is real important for being able to improve our immune system and everything else. This is me on the left saying what fits your busy schedule better: exercising 1 hour a day, or being dead for 24 hours a day. So what's it going to be, boo-boo? All right, so exercise. You've got to exercise. We've shown the research, absolutely, exercise is critical to reducing your risk of dementia, especially dancing. Dancing is great. I dance every day. All right, I make my lunch and I put on the salsa music. I'm dancing. All right, so you got to dance. Very important. Now, what we show in the data is this: we need 150 to 300 minutes of aerobic exercise per week. Don't do it all at once. Spread it out. Do the math. Figure it out. Now, we show that it improves your health for so many different ways, and it's never too late to start. If you can't do much, start with where you are. Just start. And what we also show, this is critically important right now, because being isolated and being more at home and not having all these wonderful gatherings, I miss all of you too. All right. So the thing is, we need to exercise, because exercise makes us happier than actually having more money. So we want to be able to exercise. You feel good about yourself when you exercise. So we need that 150 to 300 minutes a week. So make sure you're doing that. All right. So that's exercise. Next area, if you are a smoker, you must quit now. You must, because that puts you at significant risk of complications due to COVID. So you must quit. There's so many different adverse effects from smoking. The best book to get is this one, Alan Carr's Easy Way to Stop Smoking. Every single one of my clients who has used this book has quit for good. All right. And Ellen DeGeneres used it as well, but it's fabulous. It really works. Every one of my clients has used this. So definitely do that. Now, I know a lot of you people have a habit of being able to try to medicate yourself and relax at the end of the day. You've had a hard day and you want that glass of wine or that drink or that beer, whatever the case may be. But here's what I got to share this with you so you know. You got to know the truth, okay? There is no safe level of alcohol, none whatsoever. No safe level of alcohol. The American Medical Association issued a letter to the Dietary Guidelines for Americans, and they said this: there is no safe threshold for alcohol and cancer risk. All right, my friends, you've got to get it straight. There is no safe level. I know it's enjoyable for a lot of people, but you know what? There's no safe level. We have the information from the CDC as well. Drinking any kind of alcohol can contribute to the cancers of the mouth, larynx, esophagus, colon, liver, breast. Okay, it goes on. It's not good. And in fact, think of it this way. Think of it this way. One bottle of wine per week is the equivalent of 5 cigarettes per week in men and about 10 cigarettes per week in women. I know a lot of ladies, I mean, they have those pictures of their on Facebook of hanging out with their friends, drinking a glass of wine. Don't do that, okay? Don't do that, all right? So please stop drinking the alcohol. In addition, what we show is this, and this is data out of Australia, and what we show in the Journal of Psychopharmacology, that alcohol has the greatest amount of total combined harm to self and others compared to all these other drugs. Whew. All right, so please, especially now, stop the drinking. Will really make a difference to be as healthy as possible. Another major factor is going to be improving your sleep. So let's talk about sleep, because not only does it sleep apnea increase the risk of Alzheimer's by 70%, that's alarming. We need the 7 to 8 hours. Memories are consolidated in your deep sleep, and basic rule of thumb, shorter sleep equals shorter life. That's how you have to think of it. So it's really important. When it comes to chronic disease, so here's what we show. The sweet spot, this is the data on just type 2 diabetes. We have it on many other conditions, but the sweet spot is around 7 to 8 or so hours. So this area here, 7.5 hours of sleep, is pretty much the sweet spot area where we have the lowest amount of risk. So if we have less sleep, we have higher risk. And if we have too much sleep, we also have higher risk. So the least amount of risk is in this sweet spot area of about 7.5 hours of sleep. So that's what you want to target. It's rather fascinating in the data, what we show. And we just went through this in the fall of changing the time. So it's really interesting, because what we show is this, that all the areas where there's daylight savings time. And so in the spring, when we change to daylight savings time, what we notice the next day is that there's a 24% increase in heart attacks the following day. The emergency room departments can actually set their clock to it. All right, there's also an increase in car accidents and suicides. In the fall, which we just did, we changed back to standard time, there's a 21% decrease in heart attacks the following day. So that's what we noticed. So to improve your sleep, the number one thing that all the scientists, the leading experts say is have a regular schedule. Have a regular schedule. Go to bed at the same time, wake up at the same time. That will make the biggest difference. The routine will help you better than anything else. Now, I also have another tip for people, especially who have insomnia. One of the things that you can do is you can actually go ahead and get a journal and put it on your night table. And then before you go to bed, you write down 5 things that you are grateful for that day, specific to that day and unique to that day. All right, don't repeat anything from any previous day. But it's really an important practice, because the practice of gratitude is one of the most influential ways to actually put us in the parasympathetic state. It really makes a powerful difference. So it helps promote our health and our mental health and well-being as well. Really makes a difference. Now, talking about stress, so what we show in the research is that there are two types of stress. Eustress, which is optimal and functioning stress. So we want a healthy amount of stress, but there's also distress, which means there's too much stress. And when we have too much stress, it leads to inflammation, shrinks the brain, causes the sympathetic state, all kinds of problems. And that's not good because that puts us at risk for complications due to COVID. So practices like meditation and awareness and eliminating multitasking, my friends, multitasking does not work. All right, so you got to do those. Those are the things that will help us to unwind. Probably the most important tool that I want to share with you, I'm going to send you a video from Dr. Andrew Huberman, and he is amazing. He's got all this great research on this. And what he studied is that we naturally do this particular thing. So when we sleep at night, we have this way of being able to offload excess CO2 by taking a deep breath and then pausing, breathing in a little bit more, and then having a deep, long exhale. Now, we do it in our sleep without thinking. It is a natural neurological process in our body. When we are in the parasympathetic state and sleeping, we will naturally be able to breathe this particular way. And as a result, we offload the CO2 and we trigger being in the parasympathetic state even more deeply. Now, what Dr. Huberman has actually studied is that when we consciously do this, then we can actually trigger being in the parasympathetic state more quickly. And it's really a wonderful skill. So I'm going to invite you to practice that. It's a really very powerful tool. I've been working with my youngest son. I'm coaching him full-time in swimming. And so when he is recovering between intense swims, I'm having him use this breathing approach. And it's being very effective, really been effective. So very, very good little tool. All right, so the next area I want to talk about is relationships, because this is really important, especially now. A lot of us have been cut off from the people that we love because of isolation, not gathering, those kinds of things, but we can still attend to our relationships. And what we show in the research from Harvard that started back in 1938 is that how happy we are in our relationships has a powerful influence on our health. It really does. How happy we are. So by tending to your relationships is a form of self-care too. It really is. So we need to tend to our relationships in whichever way we can. Now, these days, that means Zoom meetings, phone calls, whatever we can do, emails, whatever we can do to tend to our relationships as much as we can. That's what we have to be able to do. Now, I learned something about relationships a long time ago, that a good practice in interacting with other human beings is to practice the golden rule, which is do unto others as you would have them do unto you. And I've always strived to practice the golden rule. It seems like a really good rule. I've always been a good kid, so I always practiced being able to be nice to people. And I think it's a good rule to follow. But later on in my life, I discovered that the golden rule, as good as it is, it has a flaw. It has a flaw because it assumes that other people have the same preference for what they want as you. And it's not necessarily the case. Everybody's got their own different preferences and what they feel would really feel good for them versus what you feel. So there's been an upgrade to the golden rule, and it's called the platinum rule. The platinum rule, in case you didn't know, is that we do unto others as they would want done to them. It's not about you. Oh, this was humbling. This was very humbling when I discovered this. So 2 books that I recommend. If you haven't got these already, haven't read these already, please run and get these. Gentlemen, run to the store and get these, all right? Or order these on Amazon, whatever you want to do. So The 5 Love Languages, absolutely fabulous, an amazing book, fantastic material based on a tremendous amount of research. And then for those of you who work in workplaces, this is absolute gold. The 5 Languages of Appreciation in the Workplace. Really fantastic. Both of these are amazing. The 5 languages in summary are: number 1, tangible gifts. Some people love getting the Starbucks gift card, but not everybody. Some people would rather have quality time with you. And still, some people would rather hear it. They need to hear, thank you, I appreciate you. Your work means so much to me. All right, words of affirmation. But some people still need to feel it. Of course, it needs to be appropriate, but they need that high five or the hug or the fist bump, whatever the case may be. But others still need to experience you pitching in to help them when they're busy, and that's acts of service to contribute to them. So these are the 5 languages, and what we show in the research is that, generally speaking, we are wired, each of us, to have as a predominant language of appreciation with 1 or 2 of these, usually the case. Now, some people say, I want all 5. Well, the thing is, we're driven by usually 1 or 2 that are most significant. Now, to determine another person's language, you can do 2 things. 1, you can either do an online assessment. So there's the management by assessment by appreciation inventory, or the 5 love languages appreciation inventory online, or you can pay attention indirectly to what they express, what they request, or what they complain about not getting. All right, so you just pay attention to people. And if you have difficulty ever remembering what the 5 love languages are, all you've got to do is just simply remember tacos. As my good friend Chandra is all about tacos. So you just have to remember tacos. So as Joshua Perez says, words of affirmation. Your tacos are delicious. Okay, acts of service. Oh, I made you these tacos just for you. Receiving gifts. Oh, here's a taco that I got for you. And then quality time. Oh, let's go out for tacos together. And then finally, my favorite, physical touch. Oh, let me hold you like a taco. All right, I hope that brings a little smile to your face. Just remember this, my friends, that a person's greatest emotional need is to feel appreciated. And it's not only for others, but it's also for ourselves. So keep that in mind and communicate to people that are your family and your friends. All right. So it's really important that we feel appreciated. So it's very important right now. One of the people that inspired me a great deal in my growing up was John F. Kennedy, and his book Profiles in Courage I'll never forget. It was a great book. And one of the things that President Kennedy had in his Oval Office was this up in a frame. It says, when written in Chinese, the word crisis is composed of 2 characters. One represents danger, and the other represents opportunity. I've never forgot that. And the way I try to look at this situation that we're in right now with COVID-19 and this pandemic is being able to look at the reality. Yes, there is a danger, there is a risk. But yes, there's also an opportunity if we know where to look. And if we look, we can find it. I love this slide because this is really how we have to view this. You know, when this is all over, what should change? And I loved her response. Everything. I agree. Everything should change. Everything. We can't continue to do the same things over and over again, expecting different results. That's insanity. So how do we prevent the next pandemic? So the next pandemic, first of all, we need to be able to stop consuming factory farmed animal products. Absolutely need to stop that. All right. Whatever your political affiliations, whatever your beliefs, whatever they are, all right, we've got to stop consuming factory farmed animal products. We've got to do that because that's just that's the breeding ground for all these viruses. We need to move towards a predominantly whole food, plant-based diet. We need to move towards that. And then practice improving living a healthy lifestyle, every single one of us, and teach your children, teach your grandchildren, teach your friends about how to do this. steer them to lifestyle medicine. And I've got a YouTube channel full of videos, all right? So all kinds of things. And support environmental and climate change initiatives. We need to be able to do that because we're destroying ourselves and the planet. So we've got to end that. We've got to start to make some changes. I love what my good friend, Dr. Garth Davis, has to say. Now, he wrote the book Proteinaholic, and he's really a brilliant physician. And he said, nothing could be a better breeding ground for disease than a factory farm. COVID-19 is a zoonotic disease, meaning it originated in animals and got passed to humans. Calling this the China virus is a real problem because it lays the blame elsewhere. The next pandemic could easily start anywhere. Absolutely true. And my other friend, Dr. Angie Sedegi, she says that these outbreaks need to be dealt with proactively by focusing on prevention, in my opinion. In my opinion, all places where animals are kept in unhygienic surroundings, be it at a wet market or on factory farms, should be shut down. Else, history will repeat itself. And the American Public Health Association, we're calling for a complete moratorium shutdown of all factory farming. If we do that, my friends, then we might be able to step inside of this. And then the whole world walked inside and shut their doors and said, we will stop it all, everything, to protect our weaker ones, our sicker ones, our older ones. And nothing in the history of humankind ever felt more like love than this. I love that. So when it really boils down to, my friends, is that we need to choose love. Choose love not only for others, but also for ourselves. We need to love ourselves and love our bodies and really take care of ourselves. We have to be responsible for ourselves and take on being responsible for the planet that we live in. And being able to do that consciously and awarely will make a profound difference. So this is what we need to be able to do. So I've given you a lot of practice besides the 5 rules that I shared with you earlier. Additionally, I'm going to challenge you to drink more water, to consume more whole grains, legumes, fruits, and veggies, to move more, to reduce your alcohol or smoking, if not eliminate them, improve your sleep habits, take up a gratitude journal, reduce your stress, appreciate others in every which way you can, and definitely love yourself and others more. These are practices that we can take on. These are things that we can do that can make a difference. So now, how do we create this thriving, healthy, happy lifestyle, even in the face of COVID-19 and potential future pandemics, because they're going to happen? So my question is this: would you like to make the rest of your life the best of your life? I hope the answer is a resounding yes. So imagine for a moment, if you would like to have that, what would that look like for you? If you were living your best life, would it be a life filled with vitality and energy and enthusiasm and being able to do great things physically, having great joy? Would you want to be able to finish your life with great health, energy, vitality, and fun, dancing to the very end on the beaches of this beautiful world that we live in? So the question is this now: if that's what you want, where are you now? Are you there yet? Chances are you're not. So the question then becomes, how will you get from where you are now to where you want to be? You need to have a plan, right? Absolutely. Absolutely, you need to have a plan. But more importantly, do you have a plan that's proven to work? Chances are you don't. Most people don't, but I do. And I'm living proof, because a little over 25 years ago, I was 55 pounds heavier, high cholesterol, high blood sugar, and high blood pressure. The nurse practitioner told me I had issues, but I didn't care until somebody called me chubby one day. And then I started to go back to what I had learned, but had not used. And I started to use what I had learned and started to change my life using a 4-point plan that works in sports, it works in business. Guess what? It works in health. So my 4-point plan, very simple. It's no nonsense, but it works. First of all, we've got to begin from within. Einstein said the significant problems we face cannot be solved at the same level of thinking we were at when we created them. So we've got to rewire our subconscious mind. Now, have you had a course on how to rewire your subconscious mind? Chances are you haven't, but I can teach you how to do that. Second, we need to have a proven strategy based on evidence, because doing the same things over and over again, expecting different results, is the definition of insanity. So I have a proven strategy. Third, we need to set ourselves up intelligently with support and accountability. No athlete gets to the Olympic Games without support and accountability. It just doesn't happen. All right, so we have to be intelligent. Nobody graduates from high school without teachers or without books. So we need to be intelligent and surround ourselves with the right people that can support us and hold us accountable. And then fourth, we've got to develop a track record of success with developing the consistency, because that's the only way we develop the habits, and habits produce results. Long-term results are only produced by habits. So we've got to have all 4 of these pieces. It's no mystery. It's no accident. It's no weird stuff. It's a lot of hard work. I'm not going to kid you about it. So what I do for people, some of my services, just to let you know a little bit, I do lifestyle medicine consultations with people where I work with you one-on-one to help you develop a personalized lifestyle medicine health plan. So I do this with you. You fill out extensive information, and then I set up a one-on-one session. I can do this by Zoom, and it's wonderful. This is my friend John. This is John, 75 pounds lighter and happy. All right, so be like John. All right, and then I set you up with lots of information. That's a one-on-one service. I also do a group program. I do the Evolving Health Lifestyle Medicine Immersion program. I am now doing these virtually. So the first 2 programs in 2021 will be virtual. So instead of day 1 and day 2, it actually will be weekend number 1 and weekend number 2. So I break it up over the course of the 2 weekends. And it turned out, we did it this last time in October, and it was really great. A lot of people loved it, and it was wonderful. So it's a group program. It's wonderful. And the next program will start in February 2021. I'll send you the information in the email. Here's one of my superstars, and this is Donna, who first did the program in April, May of 2018, and then now here she is, 70 pounds lighter. By the way, she's still 70 pounds lighter and doing great, and still active and walking and riding her bikes and all kinds of things. So she's doing great. She's awesome. 68 or 69 years old, doing fabulous, just fabulous. And if you're an employer and if you want to make a difference for your employees, I also offer a lifestyle medicine in the workplace immersion program, and it's fantastic. So it's a way to really improve the quality of your health, decrease your health insurance risk scores as well for your insurance premiums. So that helps as well. So if you need any more information, I'm easy to find, easy to reach. My website has been revamped. It's coachrubin.com. I have all my, I'm going to be posting all of my webinars on Sundays on my website. So you can go there and you can get on the link and register for any of them. I also offer all these other services. So time for some questions. So let's set it up here. Let me see. So turn on your mic if you want to talk. Let me see. I'm going to check the chat window here real quick. Let me see here. What do we got? What do we got? Okay, so let me check my chat window. Okay, got all kinds of things. I did express that. Yes, we are. Let's see, Sandra, you asked if my stats are specific to the US or are they universally valid. I have the stats that are in, there are a variety of different statistics that I presented. Some were US and some were specific to certain areas, and some were universal. Okay, is factory farming the same as wet markets in China as shown on my slides? No, factory farming is where we cram 10,000 animals in this one barn, and we put them in that barn, put them in cages and all kinds of things like that. So it's a little bit different. And then what category is asthma fall in as far as that's a respiratory disease? All right, so asthma is a respiratory disease. It's not cardiovascular. Okay, let's see. Do I think that supplements like vitamin D and zinc would help strengthen one's immune system? We do not recommend that. Sometimes some people are low in vitamin D, but we do not recommend in the American College of Lifestyle Medicine any mineral supplementation. We do recommend vitamin B12, all right, but sometimes some people are low in vitamin D. Let's see. What happens to people who convert or plan to convert to a keto diet? Well, if they go to a keto diet, they're going to end up having much more of the protein, which is going to end up causing more long-term chronic disease. All right, and that's what we show in the research. Let's see. Is shortness of breath the distinguishing difference between COVID-19 and the flu, or are they two completely separate viruses? Can the flu turn to COVID-19? All right, so influenza, which originally came from ducks, all right, is a different virus than this COVID-19, so they're different. So what happens in the flu, sometimes a person can get a flu and get a shortness of breath. In fact, it can sometimes lead to pneumonia and lead to death. That is one of the complications from influenza. But the COVID-19, what typically happens is that it's a little bit different. You have the three types of symptoms. You have the cold symptoms and the flu symptoms, and then it goes to the cough. And then that persistent cough leads to the pneumonia. So there's a little bit slightly different clinical picture when it comes to the COVID-19. You could get shortness of breath in both of them. Let's see. That's great. You're going to go back to dancing, but for right now, you're going to partner dance with your refrigerator handle. I love that. Okay, great. Let's see. Can I get on a news channel for an interview? I would love to. All right, would love to. Set me up. Okay, let's see. Okay, so in my opinion, when will the COVID-19 be behind us? All right, so that's a really good question, because if we look at the pattern of what happened in 1918, 1919 with the last great pandemic with the Spanish flu, it took almost a whole year, basically, before it was done. The experts that I've been looking at, they have been projecting anywhere from 1 year to 2 years for this virus to finally dissipate. Whether or not the vaccine comes into play, all right, it will still last quite some time. Now, the challenge that we have in the United States is that we do not have a coherent national plan. We do not have people cooperating. We have rebelliousness. We have people that have been discounting it, and they've been getting sick and dying. So we have a lot of rebelliousness, and it quite frankly is we have a lot of ignorance. Okay, so we have that. So as a result, we're probably going to be in for a longer ride here in the United States. Places like New Zealand and Taiwan and Hong Kong and many other countries that they had an intelligent approach to this, even South Korea. South Korea came up with this virus at the same time that we did, but they've been implementing an intelligent approach. Now, many other countries have implemented wash your hands, distance, wear a mask, and they're all wearing masks. You know, like 98, 99% of the population is wearing masks. All right. And they didn't shut down their economies, but because of doing those three things, their cases are like next to nothing compared to us. So that's the problem that we're having. So we have to educate. That's why I'm passionate about doing this, because people need to be educated. They need to be informed. And there are people that, I mean, I have some friends that are wearing a mask is a restriction on my personal freedom. Hell no, I won't do it. That's being a rebel. Just saying, hell no, I won't go. You know, that's got to end. That's got to end. So that's what we have to be able to do. All right, so let's see. Have I written other books besides Evolving Health? Yes, I've written actually 3 books on swimming technique called The Swimming Drill Book. but it has nothing to do with health. All right. So I am writing my next book right now. I'm on chapter 20. Got 9 more chapters to go. All right. So real important. Now, if a person does not get enough sleep, can one take a power nap daily to make up for it? There is no making up for lost sleep. However, power naps do help. Okay. It helps. All right. Doesn't mean you can't make up from lost sleep. All right. Let's see. Thank you, George. Let's see, if one cannot even have a flu shot because of immediate side effects, flu-like symptoms for at least 1 to 2 weeks, how does the vaccine affect a person who is really sensitive, even getting a flu shot? Do you think that each of us need to have the COVID vaccine? Great question. All right. So as I showed in the graphic back and since early 1900 to about 1980, most of the infectious diseases were already coming down due to public health measures, not because of the vaccines. So vaccines really did not mitigate the infectious diseases. Okay, it really didn't, except for the case of polio. All right. So, but for the most part, public health measures. That's my background. Okay, so that's what made the biggest difference. It really did. So taking the vaccine is at the end of that cheese. Remember the Swiss cheese model that I planned? That's at the end. All right. If you do all the other stuff, then you're going to still be fine. Chances are you're going to be fine. And if you're sensitive to it, which I know I am, so I don't touch the flu shots, and there's no way I'm going to take the vaccines. No way. I already had it. I'm not going to have it. The best thing we can do is do all the other things before the vaccine. The vaccine is a man-made solution that really is not adequate. So some people are desperate for it, but it really is not the answer. It's at the tail end. All right, other questions? Let's see. Anything else? Anything? Anybody? Unmute yourself. I think I answered everything on the chat window. Unmute yourself if you have any questions. Love to have you on. Anything at all? Got all these wonderful people here. Yes. Anybody? Anybody? Yes, Tina, go ahead.
Okay, so my family, they all want to get the vaccine, and if one of us refuses to get the vaccine, they don't want anything to do with us.
Okay, well,
I'm afraid because when I have the flu vaccine, I got really, really sick. So I only got it twice. And I really am afraid to get it again, even though they highly recommend it for COVID right now to get the flu vaccine.
No,
it's because I know what the effects of the vaccine is on me, the flu vaccine.
Right.
I never did get it after that.
Right. Yeah. So again, I would recommend that you do all the other things. All right. So everything that we talked about today. All right. So wash your hands, distance yourself, wear a mask. All right. Avoid gatherings. All right. Do those things and follow everything as far as the lifestyle medicine approach. So whole food, plant-based diet, drink your water, all the things that we talked about. Do all of those things. That's going to give you 99.9% effectiveness. Okay. That vaccine may be 1/10 of 1%. I wouldn't worry about the vaccine. Now, for people who are not eating healthy, they have an unhealthy lifestyle. All right. They're desperate for a vaccine to try to save them. And they think that if people have not had the vaccine, that they're at risk. No, that's not the case. They don't understand how this works. So for me, I'm not having the vaccines. I'm having nothing to do with it. So, and a lot of times there are components in the vaccines that are not healthy at all. So I'm not doing it. Okay, other questions? Anybody, anything? Anything at all? Anything? Ask away, fire away, unmute yourself. This is community. Come on now. This is a chance to have community. All right,
Ruben.
Yes, George.
Yeah, let me ask you a quick question. I was trying to figure out, like, when will this totally be behind us? Like, or is this a recurring thing with the COVID-19? Like the flu is every year you have to worry about the flu. So will we have to worry about COVID-19 every year? Or can I, let's say, a year from now, not ever worry about COVID-19 again?
The answer, my friend, unfortunately, is we don't know. We don't know. This is new. We've never seen anything quite like it. It behaves very differently than anything that we've ever seen. And so, okay, good question. So we've never seen anything quite like it, and it has such a wide range of symptomology. All right. So in terms of how we see it, it can be asymptomatic, mildly symptomatic, more severely symptomatic, or hospitalization complicated. So there's this wide spectrum. We don't know. And since it transmits so easily, it's a respiratory virus. So it could be around for a long time. We don't know. Dr. Fauci seems to think it'll be a couple of years. So a lot of other people think it'll be 1 to 2 years. So it could be a while. We don't know. Sorry, George. I wish I knew the answers. I don't have a crystal ball. One thing I'm lacking. I need a crystal ball. Will somebody please get me a crystal ball? All right. Any other questions? Anything else? Let's see. Yep. Tina, yeah. Oh, there's another question. Okay. Are there any herbs to help us? Good question. All right. So one of the things that you can look at is the vast majority of what supports the immune system is going to be the food from whole foods. So you want the greens and the fruit and the veggies and all those healthy foods. So you want that to really support us. So that's really important for us to be able to get. Now, herbs are plants. Okay, so herbs can also help as well. And we use herbs a lot of times for spices as well. So that contributes to it. So absolutely, yes, herbs, there's many, many kinds of herbs, and they all have wonderful values to them. We are studying more about herbs and spices than ever before. Like, for instance, we know turmeric, for instance, has wonderful anti-cancer benefits. I mean, there's so many different herbs and spices that are just fantastic. My basic rule of thumb is this: get as many plants as you can and lots of spices. Add that from the herbs and get plenty of that. And I love Thai food, Vietnamese food, Ethiopian food, Mexican food. I mean, so I put all this stuff on. So absolutely, all of that helps. And there's so many research studies that are coming out now in terms of the clinical benefits and the nutritional benefits. So there's lots of good things. If you're a healthcare worker, here's a good question. So if you're a healthcare worker, in terms of getting the vaccine, I have mixed feelings about that one. Because here's the thing, if you're doing everything that we're talking about today in terms of really maximizing and optimizing your lifestyle and your health, then you're doing the best things possible for you to be healthy, to mitigate, even if you do get the virus, you'd mitigate the effects of the virus on your body. So I went through it, but it did hit me pretty hard. So, but I went through it. So the thing is, that's what I recommend. And, there are mixed messages in terms of vaccines. I did not have my two younger boys vaccinated growing up. They're 20 and 22 years old. They're healthier than anybody I know. They are. They're just incredibly healthy. Now, going to college, they had to get the vaccines, just a limited number of vaccines, in order to attend college. So they did that at 18 and 19 years of age. So, but it's been minimized. So the thing is, I really try to minimize all of these vaccines. I think the problem that we see, that's a whole other topic and I'm not the expert in that, but I think we have far too many vaccines and we don't know the effect of these vaccines right now. I'm not excited about, oh yeah, we're going to have a vaccine. It's going to be really great. It's going to do everything we want it to do. I don't think that's the case. I don't think it's the case. I have serious reservations about it. Okay. All right. Anything else? Anything else? I'm happy. I'm here for you. All right. So any other questions? Going once? Going twice? Sold. All right. So thank you, all of you, for being here. My deepest heartfelt thanks and appreciation. Please please, please share this with your friends and your family members. Okay, please share this, all right? Because this is what we're trying to do in lifestyle medicine. We're trying to make a difference for the entire planet, for everyone in the world. So please don't be stingy. Share this information, share it widely, let other people know about this. This is important information, especially now. So please share this. Look at the email when I send it to you. Share this link to this video, share it widely, help other people. You may save a life or two. It's up to you. And all the people that have been on this, all right, between all of you, you could save a couple lives. That could be a lot of people. It could be a lot of people. So please share it widely. So thank you, thank you, thank you. I appreciate you all. I love you all. I will be on next Sunday. My next webinar will be on next Sunday at the same time, and it will be the 5 secrets to living a thriving, healthy, happy life. It's fantastic. I love this material because we deal with your mindset and how to really be happy. How many of you want to be happy? We're going to talk about happiness and the happiness advantage, new material. Oh, fantastic stuff. I can't wait to share it. So thank you again for being here. If there's anything I can do for you, please feel free to text me, to email me, to call me, to messenger me, whatever you want to do. So I'm on Facebook, whatever you want to do, just reach out to me. So anyway, thank you so much, and we'll see you next time. Okay, bye.